In this case study, Sarah is a newly graduated nurse and Mr. James is a 72-year-old patient living with chronic obstructive pulmonary disease. There are several factors in this scenario that have contributed to a breakdown in communication, eventually leading to Mr. James' frustration and dissatisfaction with his care experience. This scenario highlights the importance of therapeutic communication and the potential consequences when such techniques are not effectively applied. COPD commonly results in repeated hospital admissions, persistent shortness of breath, and an overall decline in quality of life, all of which can significantly impact the patient's emotional and psychological well-being. For many patients with chronic conditions, the loss of control over their bodies and daily lives is already difficult. When communication is unclear or lacking, it can make them feel even more helpless, often triggering emotions like frustration, sadness, or isolation. When Mr. James expressed his frustration, Sarah replied with, "We are doing our best. There are other patients who need our attention too." While this response might reflect the reality of a busy hospital setting, it unintentionally dismissed Mr. James' feelings and conveyed a lack of personal concern. Rather than calming the situation, such a response can make a patient feel unheard or unimportant. In addition to our words, Sarah's nonverbal cues played a significant role in shaping Mr. James' perception of care. Avoiding eye contact, rushing through tasks, and maintaining a closed-off body posture are all nonverbal signs that may communicate disinterest, discomfort, or impatience. Research by O'Hagan emphasizes that these kind of behaviors can significantly disrupt the development of a therapeutic communication between nurses and patients. A patient is more likely to trust and open up to a nurse who appears alert and emotionally present. To create a more therapeutic relationship, Sarah could have incorporated key communication techniques that are found in nursing practices. One such technique is active listening. This goes beyond simply hearing the patient's words. It involves giving full, undivided attention, maintaining appropriate eye contact, using open body language, and offering verbal cues that indicate interest and understanding. For example, if Sarah had paused her tasks and acknowledged Mr. James' emotions by saying something like, "I can see that this has been really frustrating for you. Would you like to talk more about what's been unclear?" she would have shown empathy, care, and respect. Such responses can help de-escalate emotional tension and foster a sense of collaboration and safety. Another valuable strategy is reflective listening. This involves repeating or paraphrasing what the patient has said to confirm understanding and validate their feelings. If Sarah had responded with something like, "It sounds like you're feeling left in the dark about your condition," she would have demonstrated that she was truly listening and taking Mr. James' concerns seriously. Reflective listening not only affirms the patient's emotions, but also encourages further dialogue, which is essential in building a strong connection and assurance. In conclusion, while Sarah's reaction may have resulted from stress or inexperience, her response unknowingly contributed to a breakdown in communication and trust. Mr. James' worsening frustration and disengagement were a result of not feeling heard or understood. By applying therapeutic communication techniques such as active listening, empathetic responses, and reflective listening, Sarah could have created a more compassionate and supportive care environment. In doing so, she would have not only improved Mr. James' emotional well-being, but also enhanced his engagement in care and overall satisfaction with the healthcare experience. Thank you.